welcome to another edition of NHIS in a Week. The headlines. NHIS CEO represents Ghana at the Robert Koch Institute. NHIS trains staff on EPMS and new grade structure. World Bank partners NHIS to train staff on claims generation and submission. Now the details. The CEO of the National Health Insurance Authority, Dr. Okoboy, presented Ghana's health financing history at the renowned Robert Koch Institute in Berlin, Germany. At the lecture, he detailed Ghana's 20-year journey in the health insurance space and re-echoed possible lessons Ghana can pick from Germany's experience.
The National Health Insurance Authority and the scheme was given birth to in 2003 by an Act of Parliament, Act 650. And this law established three things. First of all, it established a national insurance scheme, which was more or less a social scheme that was heavily tax funded. And so you will hear of premiums and processing fees, but they are just tokens. They are not real, because the premium in Ghana for a year is less than €2 for 12 months. So it's largely not the typical premium. It is only more or less a token to get people to be interested in the scheme. And in 2012, we moved from a mutual-based scheme. So Ghana has about 170 districts, and every district, by the law, had their own scheme, with their own board, with their own staff, and with their own fund. But 4 years down the line, in 2012, through another Act of Parliament, an amendment, Act 852, Ghana now had a unified health insurance that was centralized with a board and that had presence across the country. And so this year, we are in 2023, that's about 20 years down the line. And I'm happy to say that we've had a lot of achievements, and as you have with all organizations, we have had challenges too. And the good news is that one of the best tools being deployed to address our challenges has to do with digital health financial solutions. Who are those who visit the hospitals don't have information? And so what this leads to is that when providers engage in illegal acts like taking money from people who are already on the scheme, the excuse they give is that they've not been paid for over a year and nobody has a means to verify. So we've introduced this policy where now the file, we pay an average of $10 million every 30 days at the insurance for care, every 30 days, $10 million. Now, what we've done is that the file of payments now is published on our website. So if you go to, right now you go on your phone, you go to NHIS, nhis.gov.gh, and you open the website, you go to the top left corner and you click the options, you see claims payment. And when you click on claims payment, you can type the name of a hospital and the district, and you can see what they have received in the last 3 or 4 months.
The NHIS has launched a regional staff sensitization program to educate staff on the implementation of a new grade structure and electronic performance management system, also known as EPMS. The sensitization program, led by the Deputy Chief Executive in charge of Administration and HR, Dr. Mrs. Yapokia Baden, featured presentations, interactive sections, and demonstrations of the new module.
Then we have the Bono region, and when I joined Greater Accra, I experienced so much activities apart from registering constituents within their catchment area. They had eye screening, they had health screening, they were playing games, and then they topped it up with some sumptuous meals for buffet as well. So this tells me that you are ready to celebrate, but then we are also interested in your welfare. And so let's listen with rapt attention as we go. I mentioned that we did in 2012, but it started from somewhere. When we joined in 2017, as I said, the ball went round with us in 2018, and so we had to do something about staff salaries and staff grade. And so we did a 5-year corrective notch.
A total of 178 NHIS staff in the Eastern region were the first to receive training on the new salary and grading structure. The World Bank has partnered with the NHIA to train Tier 3 health providers in the Eastern region. The two-day training held in Koforidua focused on efficient claims generation and submission.
This system can be used for other functions in the hospital beyond claims processing. But no, this system is strictly for claims processing. If you expect to use it for some payroll or some other function aside claims business in the hospital, you can't use this application for that. Now we'll talk about how you can deploy the application. So there are basically 5 ways by which you can do that. Okay, and the first one is what is common to both of you, those in the chief's compounds and then the health centers. What we call the standalone deployment. So as the name depicts, you have a computer that is not connected to any network. Probably you don't even have a local area network. So the computer stands on its own. So you can deploy the application for such a situation. And then you can conveniently use it to create your claims, validating and then submitting like we've explained before.
The training was extended to the Volta and OT regions, where participants were trained on the bespoke claimant application and the electronic claims processing and management.
The prescriptions are invalid at all. The formats that you present from the systems are invalid. And I hope when you get your light wave, you will not be doing this for one error.
Sometimes we know what to do, but our attitude towards what we are supposed to do is not the best. And it is time for us to also change our attitude so that we can manage our claims more efficiently and more effectively. Another thing that I want to draw your attention to.
And so that explains why we find ourselves here. There shall be 4 presentations. You are very much aware that we've moved on to electronic payment, the claim IT system. Now it's a little bit, it's not all places. Don't be worried at all. Before the end of the year, as one of the facilitators will tell you, we shall very soon move on to the Android version. So on your phone, you can just push it on it and it will come to us with vet and quickly your monies are paid.
The National Health Insurance Authority, with support from the Korea Foundation for International Healthcare, (KOFI), in July 2023, successfully developed and launched the NHIS Research Policy and Agenda in July 2023 at the University of Ghana Business School. Following the successful policy agenda, a team from the Research Policy, Monitoring and Evaluation Directorate has trained a total of 114 NHIS staff across the country on the manual and electronic implementation of the research policy and agenda. Speaking on how the policy can be beneficial to staff, the director of RPME, Dr. Asensu Boedi, said the training will enable staff to be able to develop themselves through educational research, thereby enhancing their skills and overall output in the operations of the scheme.
The NHIS has existed for now 20 years now. It has generated a lot of interest for both external and internal stakeholders. So we do get a lot of requests for research, some requesting for just information from NHIS, some seeking to interview staff of NHIS, and it's not standardized. So management thought it wise to get some form of policy to guide the process.
The NHIS in the North Thong district has embarked on a special registration exercise for flood victims whose homes were ravaged due to the dam spillage in the Volta region. The displaced victims who lost their valuables, including NHIS membership cards, availed themselves to this exercise in their bid to access healthcare on the scheme in these difficult times. To our final story, the Ashiedu Keteke NHIS District Office has held a retirement ceremony in honor of outgoing PR Hajia Mrs. Zainab Ibrahim Tanko, after serving the scheme and working for the NHIS since its inception in 2003. The event was attended by the Greater Accra Regional Director, Mrs. Patient Dankwa, the Regional HR, and Regional PRO, Mrs. Lydia Ejay Tutu, and other PROs within the Greater Accra region. The event also featured representatives from the Imam of Ashiedu Keteke, the staff of Asha Hospital, and representatives from facilities within the district. District managers described Hajia as a disciple of participative management and a poster woman for her hard work and dedication. The NHIS wishes Hajia Zainab Ibrahim Tanko a blissful retirement. This is how we wrap up on this week's edition of NHIS in a Week. For more stories, do log on to our website www.nhis.gov.gh and follow us on all our social media platforms displayed on the screen. My name is Sandra Amakwatha. Thanks for watching.